So I'm going to start by giving a short introduction of where Cameroon is. So Cameroon is a very small country, smaller than Kenya, Judy. It's about 22 million people. We have 2 official languages, French and English. But we have about 258 tribes with respective languages. So we have about 258 different languages in Cameroon. Also, from the map, you see Cameroon is located in, I don't know if it is West or Central Africa. Dr. Motosho usually says we're in West Africa. So we are just neighbors to Nigeria. And initially, we were part of Nigeria, but we broke, the southern part of Cameroon was part of Nigeria, but we broke up in 1960. So Cameroon is known as Africa in miniature. There's all of Africa in Cameroon. So trust me, if you want to go for a vacation, come to Cameroon. I'll personally be your tour guide. So Cameroon is known as Africa in miniature because we have a desert, as you can see here in the north. We have the savanna. We have a tropical rainforest. We have mountains. Actually, the Mount Cameroon is the second tallest after Mount Kilimanjaro. Also, talking about food, please don't salivate. We have, what is life without food that they usually say? As you can see here, we have jollof rice, Cameroonian jollof. I bet you it's better than Nigerian jollof. We also have what you see at the far right-hand corner, that's koki. It's equivalent to moi moi, what you guys call moi moi. We have fufu corn and jama, what you guys call yesemo. And at the far left, we have, I think it's eru. You guys call it okazi in the south-south. So you see Cameroon is very, very similar to Nigeria. And lastly, Cameroon is known for football. We are, I can't say currently champions, but we have been champions of Africa 5 times. And I know Nigeria is usually the threat of Cameroon when it comes to football. So I started on a lighter note because, as Dr. Motosho rightly said, we are having a socio-political crisis since 2017 in the English-speaking regions. So it's actually a stressor that was existing before the COVID-19 came into play. So the population, especially in the southern parts or in the English-speaking regions, have had a double impact: the COVID-19 and the socio-political crisis. From what I carried out my research study in Cameroon for the master's thesis, and surprisingly, 9 out of 10 mothers recognized that the socio-political crisis was actually a significant stressor in their life. And also, those who recognized this significant stress as significant stressor were 3 times more likely to be depressed. So we can see how this already affected the mental health of mothers before even the COVID-19 pandemic came to play. So the next slide, on the interviews I carried out, I asked them the reactions of the news of COVID-19, and here were some of the answers. Some said it was like an explosion, it was like a bomb blast, suddenly everything had to stop. Some said they felt trapped, they used to go out, but they felt like they were trapped both in their minds and in their lives. Others said they were sad, some said they were unhappy, while some were just indifferent, and some were anxious. So COVID-19 and mental health in Cameroon. For the general population, I also did some interviews from stakeholders and service providers. They attested to the fact that, first of all, I would like to say in Cameroon, mental health is really like a void field, because it was not easy. It was not really easy for me to get some information from back home. The few I had said there had been an increase in emotional symptoms like low mood and being anxious. And some also said there had been increased rates of depression and anxiety. I actually got this from the Médecins Sans Frontières, which is a non-governmental organization involved in humanitarian services in conflict areas. And then, as I said before, we have impending stressors. We have the socio-political crisis and its consequences. Mothers will be at home and you hear gunshots. It's really something that is really, really disturbing. You will be at home and you hear gunshots, and it's such that immediately children start hearing gunshots. The first thing they do is everybody lies down on the floor. I've been at home when that occurred, and everybody goes down on the floor. There's sometimes when you even have to sleep on the floor so so that stray bullets don't get you. And then now the COVID-19 pandemic came into scene, and people lost their jobs. People who were not working before and were doing businesses actually lost their livelihood, even though there was not a total lockdown in Cameroon, but there was some kind of limit in movement. And also schools were closed down from primary, secondary to tertiary institutions. So it was like a double impact, as I've said before. So I'll be focusing on maternal and infant mental health. So there have been widespread impacts on pregnancy, childhood, and parenthood. As we know, if we look at this picture, I'm very sorry, I'm going to pick on the men to compare that to the woman. Obviously, we can't compare the men to the women. The men are the head of the family. But one of my mentors always say the woman is the neck. The neck directs where the head goes to. So the neck works more than the head. So the woman in the family has a lot of things to do. She has to do laundry. She has to take care of the children. And many of them became teachers during this period. They had to teach the children while the men went out to fend for the family. So when I spoke to some of these mothers, these were some of the stressors they identified: the social isolation and measures removed support system. For example, normally in Cameroon, when the woman puts to bed, the grandparents usually visit, or the grandparents from the maternal or paternal visit to take care of the baby or to assist the woman. But during this time, it was quite difficult. So the lady was left all alone to take care of the baby and the children. Also, there was reduced access to antenatal care because the hospitals were kind of shut down and wanted to prioritize care for the COVID-19 cases. And so this kind of created anxiety and some kind of worriness in the mothers. There was also fear of healthcare facilities, as many people did not want to take their children to healthcare facilities for fear of contracting the virus. And there was also low immunization coverage. Vaccines were actually scarce, and sometimes children had to skip their vaccination schedules. So why maternal and infants? Why do we put that together? We know the mother spends most of the time with the baby, and it has been proven that the mental health of the mother is directly linked to that of the baby. Actually, just before the pandemic, the research I carried out showed that maternal depression was quite high. 4 out of every 10 women in the English-speaking regions in Cameroon diagnosed of depression. And we also established an association between depression and such shorter duration of breastfeeding. And so we know that, how important breastfeeding it is for the child to grow. So there is actually no doubt that the maternal health is quite very linked to the infant mental health. So, and I'm sure very sure some people will be thinking, what is infant mental health? Infant mental health is all about development of the child. When does the child achieve milestones like sitting, walking? How does the child respond to stimulus? Some children might just be irritable because they are not growing well, that their mothers are not stimulating them very well. I can remember also one of the interviews I carried out, the mother specifically said that she was quite scared to engage in playful how can I put it, playful reactions with her child, because when she goes out and comes back from the house, she's scared, oh, she might have contracted the virus. And so she does not interact very well with the child as she used to before because she's scared. All of this can impact the growth of the child. So before we get into optimizing, how do we optimize the health of mothers, infants, and all of us during this period, I just thought we should look at this spectrum. So mental health is actually a continuum. We move from healthy coping to reacting to poor mental health and to mentally ill. So some people might be in the healthy coping. So at any point in time in life, you are on one of these intervals or one of these stages. So we notice that for healthy coping and reacting, self-care and social support is very, very important. Why the professional care actually comes when you have poor mental health and you're mentally ill. So what does this tell us? It tells us that, I used to tell people that psychiatry or mental health is the only field in medicine where everybody has a certificate. Because at one point or another, you have counseled somebody, or you have spoken to somebody in a nice way and the person has reacted in a nice way, it has changed the person's behavior. So all of us are like, so even though Dr. Motoshaw presented the doctor to patient ratio for psychiatry, I used to tell people that it's a 1-to-1 ratio, because everybody can do something that will impact the health of mental health of an individual at a point in time in their life. So how do we optimize the mental health for both mothers and their babies? I would like to focus more on, because we do not have a lot of healthcare providers on this platform. And how do we optimize the mental health for both mothers? I will look at the communities and individuals. As I said before, the greatest asset we have in mental health is you and me. We can provide support in different ways. Technological advancements and social media should be a strength, rather than us going to social media to show off our cars we just bought, our new jobs. We should use that to promote the mental health of individuals, because those things, that certain things you show off that makes others to have a low mood, to make others to feel like they are not getting there. So let's use the strengths of technological advancements and social media. Also, let's support younger mothers, the older ones to support the younger ones. Something like a coaching group or a support group where, and this can be done in churches, anywhere. And we should harness our strengths. We know in Africa, or we believe we are very religious. I'm sorry to say that, but that is how we are. So that's the strength. Let's harness that strength and build that communication from the religious angle. Use those religious leaders to provide support. And for individual mothers, what should the mother herself do as a mother to promote her mental health? This actually was from one of my friends. I don't know if she's on this call, but she actually was battling with postpartum depression at some point in time. And I asked her during this period how she has coped, and this was what she told me. She started something new, she started gardening, and whenever she harvests her fruits now from the garden, she feels like that's an accomplishment. It makes her happy. She does 30-minute exercise a day, and during that time, she does it with the children at home. They sing, they dance, and that promotes her health. And then also she devised another method that when her husband, I hope the husbands here will not take this against the wife. When her husband gets back from work, she says she gets into the shower and stays there like for 30 minutes, and that'll be her own time off for the day. And the husband will take care for the kids. So what works for you? That's just it. What works for you? Look at what works for you. It's kind of individualized, and then you apply it and promote your mental health. And lastly, I want to say, lessons we have learned from previous pandemics also can help us. As I usually say, there's nothing new under the sun. So what has happened during the Ebola virus pandemic? What happened during the HIV pandemic? What was the interventions that were put in place that helped to promote the mental health of others? So I'll just point out one of it here, use of adolescents in delivering psychosocial support to their mothers. I found this in one of the Ebola virus interventions. Adolescents were used to promote their mother's mental health, especially those who had siblings. They were trained on psychosocial support, and they provided that to their mothers, especially when they found out that their mothers had a low maybe mood or had an emotional symptom. So on this note, I would like to say we should just you and me is what we can use in this period to increase the access to mental health care. We don't need the government to pour in more funds, but in our own small way, we can do something. So I'll thank you very much.